back. Dr. David Klein of the Stages of Life Institute in nearby Longwood. And we wanted to let you know about two things you really need to know. One is suffernomore.com, suffernomore.com, and the other, stagesoflifevitamins.com, stagesoflifevitamins.com. And today we talk about hormone imbalance and dementia.
Interesting way to look at life. You know, we see people, especially as they start to get older, become feeble. It's the old word we used to use. They start to get a little bit forgetful. They start to do things that they wouldn't have otherwise done. And we start making apologies for them. Then the word Alzheimer's entered into our lexicon. Okay, Alzheimer described dementia, something called pre-senile dementia, 100 years ago. Okay, pre-senile dementia. What did that mean? It meant dementia of somebody that did not reach age. So we've actually already bastardized the word to generalize into anybody that has any dementia whatsoever. What is dementia? Okay, dementia is a medical condition. It's a disease state whereby the brain isn't working in the manner that it was designed, certainly not healthy, and you start having problems with short-term memory loss, judgment, and a number of other biological functions start to hit. Okay, this is the way things go. What are the different causes of dementia? This is where it starts to get interesting. Well, Alzheimer's disease is an inevitability. No, it isn't. Alzheimer's disease is familial. No, it isn't. Alzheimer's disease is irreversible and non-treatable. No, that is absolutely incorrect. First thing you need to do when somebody comes in, or so you know somebody, or you are that somebody that finds themselves with short-term memory issues, okay, and we all have them, by the way, okay, is to make sure that you don't have something organic going on. So it's extremely important that you test for this. And I don't mean sitting down with a piece of paper and pencil and drawing a clock. By the time most of these psychometric tests are done, these pen and paper tests are done, it's already too late. Okay, guess what? Now you're just demonstrating it for the government so you can make sure that your medications are paid for. So you test first. At Stages, we have a process called CogniView, and it's very, very sophisticated. There are 10 of these units in the United States, and you sit down. You have a little wheel, and you get frustrated. The computer screen goes up, and it tests your short-term memory. It also tests your eye-hand coordination and sorts out something called signal-to-noise ratio. What is real and what is Memorex? It was originally designed by the Air Force to look for fighter pilots. Can they identify a target in real time? You're cruising along at 500 knots. You look at a truck, is it ours or theirs? These are the sorts of signal-to-noise ratios that they were looking for. It was found to be very helpful to identify early cognitive issues. We do it at Stages. Why do we do it? Not just so we can simply tell somebody that they have an irreversible condition. There are things that can be done to intervene. Hypothyroidism causes a dementia. If your thyroid's not working right, neither will your brain. Very simple, very straightforward. So we did it as a means and mechanism to test and to measure effectiveness of treatment, because the blood levels don't tell you very much. They tell you whether the thing is being absorbed, but there are hundreds of reactions that happen after the fact that hormone hits your bloodstream. So it's important to know whether you're doing the right thing or the wrong thing. What else? What other hormones will cause dementia? My favorite one's called Pregnenolone. Pregnenolone, for God's sake. Okay, what is Pregnenolone? Your body has cholesterol. We all know about cholesterol. We're told. We've been hammered that cholesterol is bad for you. What you didn't know can kill you. Pregnenolone comes from cholesterol. Cholesterol converts to pregnenolone first before it makes cortisol, DHEA, testosterone, estrogen, or any of 150 other steroidal hormones that are secreted by your gonads and your adrenals. That's the way that these things go. Low levels of pregnenolone lead to memory issues, which is why we call the product Memorex. It's pregnenolone. Okay, it's right there on the bottle. There's your hormone. There's your level. This is what you need. Memory issues tend to do better. Focus issues tend to do better. Pregnenolone deficiency causes Alzheimer's-like picture. Cortisol deficiency will cause the same issue. If your adrenals are shot, something called adrenal fatigue, when it's really, really bad, it's called adrenal failure. You'll see dementia occur. You will see dementia develop progressively over time. Well, what does this mean to you? What does it mean to your mom? What does it mean to your uncle? It means that if they have these sorts of dementia issues, you need to test them. How hard is this? Simple blood chemistries will tell you what is right and what is wrong with them. You have to have the audacity to ask your doctor to have these things tested. It's not that difficult. A pregnenolone level should be between 30 and 50. About half of the patients that I see over the age of 70 come in with pregnenolone levels under 10. And they can't understand why they can't think. They can't understand why they're not doing as well as they did. You replace it for $20, $25 a month, and all of a sudden they start doing better. They're testing better. Very, very interesting. But what about cortisol? Cortisol is important because it also, in addition to allowing you to think, your immune system finds it necessary in order for it to function as well. Every cell in your body has cortisol receptors. If you do not have sufficient cortisol, you will not think properly, you will not function properly, and you certainly will have memory issues. It's kind of interesting how this works. What about testosterone? Another interesting hormone. When men's testosterone levels start to drop, usually happens right around the age of 40s when you start to notice it. There are certain external behaviors that are you can see them. Okay, little blue pills are known to fix that. But what you don't understand and don't see is what it does for the brain. Testosterone deficiency leads to depression, lack of focus, emotional displays, and so on and so forth. The man of the house starts to turn more like the eldest daughter. It's very, very interesting how this works. As you start to get older, testosterone levels diminish even further, and that too can lead to dementia. With women, their testosterone levels start low and go to zero very early on in life. They tend to develop these Alzheimer's type pictures more commonly than men do. Wouldn't you know it? Kind of interesting. What about estrogen? Okay, as men get older, their estrogen levels go up, and that actually may be what protects their brain. But women, on the other hand, their estrogen goes to zero. The bloom falls off the rose bush. Okay, and what does that lead to? It leads to dementia. It leads to all manners of disease states. Thyroid, adrenals, gonadal hormones. And it doesn't end right there. But those are a few good examples of things that you need to look at, things that need to be studied, things that need to be examined in order for you to deal with Aunt Sally's drooling, to deal with Uncle Charlie's fumbling with words, to deal with Grandma's inability to feed herself. Because it's shocking, okay, how much function can return once you start to restore these things to a more normal level. Most important message of the day, okay, is that it's easier to prevent degradation than it is to try to clean the mess up. Okay, once things start to go to hell in a handbasket, you can try to restore some function. But it's much, much easier, much more satisfying, and much more effective to treat before the disease occurs. So I test my patients rather routinely. We pick up things all the time this way and try very, very hard, and usually successfully, to prevent the development of these disease states.
Wow. Now, the first thing I would think is we've got to get to the stages of life where you have a full laboratory.
We make it easy.
And we've got to get ourselves checked out.
It's very, very easy. If you've got Medicare, we take Medicare. If you've got TRICARE, we take TRICARE. They cover the lab work. It's very, very simple, very straightforward. You feel a little simple prick in your forearm, and then 10 days, 14 days later, you got the answer. Okay, once you have the database, once you know what you've got, it makes treatment very, very easy. Okay, trying to argue sometimes with family docs, trying to argue with the internists, it doesn't end well. Okay, you're going to walk in there with a laundry list of things that you need to do, see how well that turns out. So we're happy to help. That's what we do. We do it all day long. And then we will communicate with the family docs and the other primary care folks if we're so directed to do so. What does that mean? It means we offer, we suggest that we do it. Some people just don't like to share information. God knows why, but we'll go along.
So you get your levels. The doctor and you sit down, you talk about the nutraceuticals, the supplements you need, things that need to change in your life, and then you visit the nutraceutical store. You take aim at what you've got, you get your inventory going, and then you sign up for the StagesOfLifeVitamins.com program. It's a very simple procedure. Stages of Life Vitamins, and then you can look up the institute at SufferNoMore.com. That is SufferNoMore.com. And doctor, are you accepting new patients?
We're accepting new patients. We're accepting old patients. Whoever wants to come through the door, we're happy to see you. In fact, we're truly delighted to see you. As we live for it, and that's exactly what we do. We try to blend treatment What does that mean? It means that when you need a prescription, many of these hormones like testosterone, estradiol, estriol, progesterone, thyroid, these are all prescription items. We do this all day long. We test for it. We do it all day long. But many of them are not prescription at all. DHEA and Pregnenolone are not prescription items in the United States. In Europe, you can't get them. They're illegal. Okay, you go to Canada, South America, you can't get them. They're illegal. Here we can do it happily. At least we can for now. The vitamins and minerals are very, very helpful to get the body to bounce back to what it's supposed to do. Either way, we do that which is necessary to get you healthy and happy. Healthy and happy.